Coming up, many people will be traveling, whether by car, plane, or train. Sitting for long periods of time without moving, though, can create some serious health problems.
Georgia Peck talked with a pulmonologist today about how you can prevent blood clots on this Blood Clot Awareness Month.
Pain and swelling in your leg can lead to something much more serious. Dr. Brad Vincent treats blood clot patients at Ochsner, and he says the biggest risk factor is going long periods of time without moving.
With long distance travel, be it via car, whatever vehicle, airplane, anything that is going to take longer than 4 hours is the sort of generally accepted time frame of prolonged single position or immobility. That is where the risk really starts to escalate.
Couple that with an injury or prior knee surgery, and you have a perfect recipe for a blood clot waiting to happen. Even
a seemingly trivial injury, they got hit in the leg and didn't think much of it, but importantly, it may have caused injury to that vein. And that's one of the risk factors. So if a professional athlete, let's say, plays a game, gets injured, or even has a prior knee surgery and gets on a plane, travels 6 hours back to the East Coast or West Coast, that would be a setup for having a blood clot.
He says also make sure you stay hydrated on long trips. And your risk of blood clots can be hereditary, so it's important to know your family history as well.
Immobility is the enemy, and so movement is the solution. But even if, and there's this sort of economy class travel kind of syndrome where, you're stuck in economy class, it's cramped space, especially on a long flight. It's a pain to get up, across from your neighbor, to get up and move, walk the aisle. But you really have to ask your family if any of your close relatives has had a blood clot, and then just be on the lookout for any early warning signs, that swelling, that pain, and seek prompt medical attention if those exist and you're concerned enough about having a clot in that leg.
Georgia Peck, WAFB 9 News.
So Dr. Benson says anyone over the age of 60, of course, at a higher risk.
We were just talking about it happened to my mom. Even if you do develop a clot, though, new treatments and techniques to directly retrieve clots from the lungs are improving outcomes for patients.
A new degree program at LSU could